Myself, Dr. Swarup Saha. I'm a practicing physician from West Bengal, and today we will discuss about hypertension and its management. Well, uh, what actually hypertension is, actually, whenever our heart beats, it pumps blood into our blood vessels, and this blood actually creates pressure inside the blood vessels, and so it produces one kind of pressure, and what that is known as blood pressure. Normally, in healthy person, it actually fluctuates. I mean, there is a circadian rhythm. Sometimes the blood vessel itself is higher than the average, and sometimes it is also lower than the average. This circadian phenomenon is quite normal and physiological. But sometimes it is said, it has been seen that there are the rise of high blood pressure usually tends to be persistent in some kind of population, in aged persons, in patients having other metabolic disorders. And during that course, the persistent rise of blood pressure, which usually gets prevalent over the days, over the hours, then we say that this person is having a disease known as hypertension. Now, what are the risk factors of having hypertension? Actually, there are some risk factors which are modifiable and some are non-modifiable. Now, what are modifiable risk factors? Like our dietary lifestyle, our uh, lifestyle leading, like our food habit, percentage of salt intake in our diet, our regular exercise capacity, regular exercise habit, uh, taking excessive fatty food, processing food. These are some modifiable risk factors for developing of hypertension. Now, there are also some non-modifiable risk factors like age, like family history. But as people get older, the arteries get stiffen up, known as arteriosclerosis. And over the years, patient has the possibility of developing hypertension, is what which is seen in geriatric population. Now, there are coming on to some symptoms and signs of hypertension. Uh, there are not such specific signs and symptoms. I mean, initial stages. Whenever patient used to have hypertension at initial stages, uh, no specific signs are not there as such. That is why hypertension is actually a silent killer, we used to say. Uh, there's some signs if patient used to have some symptoms initially, that one type of headache, some kind of dizziness. These are common symptoms of acute hypertension. And also some, if patient presents with some stroke, we used to say some ischemic events, some cardiovascular acute coronary syndrome. Sometimes patient presents like this. Uh, I mean, the patient might present with some uh, mild symptoms like dizziness, headache, and also some people used to present with uh, severe symptoms like presenting with acute coronary syndrome. Patient is having first episode of acute coronary syndrome, first episode of cerebrovascular accident, and that time patient we actually know for the patient is hypertensive. Before that, we don't know the status of blood pressure of that patient. So the presentation of hypertension in a patient is variable. Uh, and regarding the signs that we get while examining the hypertensive patient, first thing we use to measure the blood pressure, and usually what we say is normal blood pressure is less than 120, less than 80 millimeter mercury, and hypertension is stamped when the blood pressure is more than 140 by 90. So hypertension is diagnosed by this method. There are different methods of measuring blood pressure. Some people use sphygmomanometer, that which are dial type, and some use mercury sphygmomanometer. And recent days we use digital sphygmomanometer also. And regarding the definition of hypertension, if we say the cutoff value is these days 140 by 90. Any blood pressure more than equal to 140 by 90 is hypertension. Normal blood pressure is less than 120 by 80. And between these two stages, that is less than 140 but more than 120 systolic, and less than 90 but more than 80 millimeter mercury diastolic, we used to stamp those people as having hypertension. And regarding examination other points, we might get another some specific features of hypertension in elderly people, like having they used to have xanthelasma, which are spots usually seen in patient having hypercholesterolemia. Actually, the patients with hypertension usually they have other metabolic disorders also, like having diabetes, like having hypothyroid, like having hypercholesterolemia or dyslipidemia. Well, treatment of hypertension is dependent not only on correcting the blood pressure, but also correction of other metabolic parameters also, like which I have already mentioned. If you have diabetes along with hypertension, you have to treat the diabetes beside giving antihypertensive. If you have hypothyroid, adjust the dose of thyroid medicine. If you have cholesterolemia, dyslipidemia, check the blood cholesterol triglyceride level and give treatment of hypercholesterolemia. Well, along with this, along with those pharmacological treatment, I think one thing is very much important about management of hypertension is always the management is modification of lifestyle. This non-pharmacological treatment is very much important. Pharmacological therapy, like modification of diet, regular exercise. If patient people having some kind of addiction like smoking and regular alcohol intake, they should quit smoking. And well, we celebrate a World Hypertension Day every year on 17th of May, and we used to make people aware. We used to arrange an awareness program about hypertension in different our institution and clinics also. Regarding non-pharmacological treatment, obviously regular exercise and physical activity is important very much. We used to offer patient about walking, more walking, usually at morning, preferably. If not possible, then evening time, please for 50 minutes a day. And regarding healthy diet, we have one point: DASH diet, dietary approach to stop hypertension. The DASH diet usually consists of eating less amount of salt, less fat, and eating plenty of potassium by different potassium-rich foods and vegetables. One thing is very important is regular blood pressure monitoring. I mean, these days we used to have digital sphygmomanometer, which can be operated by normal persons. Only medical persons can operate with this. It can be operated and trained by some non-medical person also. And we should keep one record of those things, those blood pressure values in one copybook and give it to your clinician physician during your physician visit. And regarding another thing is important about hypertension hypertension management, stress management. So we used to see that whenever patient used to have increased stress in the form of anxiety, depression, and mania, in those times, patient used to have surge of blood pressure, rapid rise of blood pressure. So it's in elderly people more, and many cardiovascular events occurred because of this rapid rise of hypertension, rapid rise of blood pressure. Well, for that stress management, there are some techniques like moderate exercise, listening to music, focusing on something calm and peaceful things, and of course, meditation is very much important for stress management. And last but not the least is the duty of physician not does not end on giving the medicine to one patient, but it will be beneficial only if the patient is adherent to that medicine, if the patient is adherent to the medicine. Adherence to the proper antihypertensive medicine is very much important for antihypertensive therapy, because whenever we used to attend patients, we used to see that many patients have discontinued antihypertensive drugs, and they are having some cardiovascular events, acute pulmonary syndrome or CVD. It's quite common. So, along with the pharmacological treatment, patients should be counseled properly about the need of adherence to your antihypertensive medicine. Well, this is this much I can say about this hypertension and its physiology and management. And last thing that we need to remember that we must always, because health is precious wealth, and we must stay fit and healthy and lead a healthy life. And it is very much possible to maintain normal blood pressure level, prevent hypertension with regular monitoring and proper preventive care.